Dr. Kevin Kavanagh. He's a retired physician and also founder of Health Watch USA. It's a national public awareness nonprofit that is becoming international in scope. Good morning, Dr. K.
Good morning, Jack.
And you have a guest from the other side of the pond.
That's correct, and I'm very pleased to have Dr. Hoehl with us. He is a pediatrician and a virologist from the University Hospital in Frankfurt, Goethe University. And he's been leading in investigations both in pediatrics, how to open up economy, and also was one of the first, if not the first, who sounded the alarm and documented asymptomatic transmission with SARS-CoV-2. So really an important researcher and someone who I'm very privileged to have on the program today.
Good morning, Doctor.
Good morning. Thank you very much for having me.
When he said he's in Frankfurt, the college is in Frankfurt. It's Frankfurt, Germany, by the way, not the one that we have here. Not spelled the same, is it, Dr. K?
No, it's not.
All right, you begin with your list of questionings. I am really very honored to have the good doctor with us this morning. Go right ahead.
Doctor, I would really like to ask you what is going on in Germany right now? What's the status of the pandemic? And really, how well are people accepting some of the measures that Germany's imposing to try to control the spread of the virus?
Well, the pandemic is still ongoing in Germany. We've recently seen another wave, another rise in cases that started after the end of summer vacation. But case numbers appear to go down now. We're seeing severe cases and deaths due to COVID now predominantly in unvaccinated adults. Right now, we have about 63% of the population in Germany fully vaccinated, which compares to about 55% in the United States. But this is a rate that will probably not prevent another rise in cases when we go into fall. So we will see how this develops.
Are you all using the Astrazeneca vaccine?
We're using the Astrazeneca vaccine for people over the age of 60, also the one by Johnson & Johnson, and everybody who's below the age of 60 has the choice of the two mRNA vaccines from Pfizer and Moderna.
How young are you vaccinating?
Well, we now have a recommendation for everyone starting at the age of 12. So our Standing Vaccine Commission took a long time to really look at the data for young kids because it's so important that the vaccine is safe. And we now have a general recommendation for everybody starting at age 12.
We are going to, in the near future, Dr. Kavanagh, I think, be vaccinating kids as young as 5 when it gets approved. Is that correct?
Yes, that's what's currently on the table with data. They have data in now on the safety. These are highly safe, and also have laboratory data that the children are getting a huge immune response to these vaccines. So they think it will be very effective in the younger age group. And so I suspect we'll see an EUA or FDA authorization down to age 5. And I think that will happen for the Pfizer vaccine within the next few weeks.
Do you have a problem with that, doctor? Is that too young, or is that appropriate in your opinion?
Well, we'll have to see what the safety data says. There were not so many children in these first studies starting at 5 years of age, so it's very important that the vaccines are safe. But if they prove to be safe as they are in older adolescents and adults, then this is another useful tool. But if we see a general recommendation in Germany, first the data will be very carefully looked at.
You mentioned that the United States is in the mid-50s in terms of the percentage of folks who are vaccinated. You guys are in the mid-60s. Why have you done a better job than we have? How have you accomplished that, do you think?
Well, that's difficult to say. It's very different by area. I think even in the United States, by state, you have very, very different vaccination numbers. And the same is also true in Europe, where we have some countries that even have much higher vaccination rates than that. Portugal, for example, has more than 80%. And a lot of that comes down to trust in public health advice and whether or not people really trust that these vaccines ought to be taken.
Well, we have a story that came out this morning that said new data from the CDC shows that the United States is slowing down on receiving first-time vaccinations. Over 312,000 people got their first COVID shots last week, 35% down from the previous month. And with flu season on the horizon, this information worries some health experts, and some vaccine clinics are beginning to offer both the flu shot and COVID vaccination. About 182 million people in the U.S. fully vaccinated, making up about 59.4% of the nation's population. Is the flu a concern of yours, too?
Oh, yes, absolutely. The flu is probably going to, because we've had such a mild season last year, it might be a very bad wave this year. And also we have RSV, respiratory syncytial virus, which can be very dangerous for very young children. And children have also not been able to develop immunity against RSV. So these are viruses that we're looking very carefully at this winter, influenza and RSV, in addition to the coronavirus.
We have a text for you on our auto tech service text line. Says, please ask the doctor if you think that the major initial lockdown, especially with younger and middle-aged people, caused the Delta variant to come back stronger when that group could have had natural immunity.
Well, and very early on in the pandemic, we really did not know a lot about how prone young children are to get severe COVID. And as far as long COVID symptoms are concerned, we are still not entirely sure how often this occurs. So I think it was very, very reasonable to prevent, and it still is very, very reasonable to try to prevent natural infection and try to study this more carefully and have the option of vaccinating.
Dr. K, isn't it true that our numbers of younger people getting COVID are up, right, or going up?
Yes, it's gone just through the roof. And one of the things that we've done here is to really open up schools, sometimes with very little mitigation strategies. Almost all the schools are requiring masking in Kentucky, just cloth masks though. And there are a few schools, however, that's optional. And I'm wondering, what are the requirements and the requirements for masking and opening schools in Germany? What are you all doing over there?
So schools are open and masks are mandatory. I mean, Germany is a bit like the United States, a federation. So the different states make different rules. But in general, children and students have to wear masks in schools, and these need to be at least surgical masks. So they cannot wear cloth masks. But when the number of infections in the community is not very high, the children are allowed to take off the masks when they are seated in the classroom. But masks generally are worn in schools.
Dr. Kevin?
Yeah, and
That's been one of the messages I've tried to get out, is that we need to have masking, especially when rates of infection in the community are high. And we need to upgrade the types of masks we're using. You hear some of our politicians saying that, let's not use cloth masks. Let's upgrade to either a surgical mask, a KN95, N95 mask. These are all now readily available. In my opinion, they should be provided by the schools for the students. I think that would be very important.
I finally got the message, Doctor. You'll be happy to know my wife got us some N95s.
Fantastic.
Are people who have had only one of the two doses being counted as vaccinated for new cases and deaths? Do you know?
I believe if you have only one or two doses, you would be counted as not being fully vaccinated. They're really looking at fully vaccinated because with these variants, unlike the wild type, with these variants, one dose of an mRNA vaccine does not provide you with adequate protection. You need to get both doses. And for some people, you need to get 3 doses or a booster, as what's being recommended by the CDC right now.
I read yesterday there's a new variant. I think it's called R.1. Am I right?
Yes, and that may have originated in Kentucky. Who knows?
That's what I was going to ask.
Yeah.
So how? What can you tell us about that variant?
Well, that originated, I think, in the Eastern Kentucky nursing home, although they said that might also be in Japan. It has a number of escape mutations, and people are right now making a big deal of it. I was more worried about it this spring than I was right now because it's been around a long time and it's pretty much just burned out. It can't compete with Delta. It's not enough for a virus to be a vicious virus. It has to also be able to spread effectively. And it doesn't look like to me that that's what this virus can do. So it's not a major threat in Kentucky.
Are you dealing with any other variant other than the Delta variant in Germany, sir?
Currently, we're pretty much only seeing the Delta variant, so we're seeing all kinds of sub-variants of Delta, but virtually all infections at the moment are due to Delta.
Are there travel restrictions in Germany?
Not so many. There are some restrictions that require people to quarantine after arrival, but there are no restrictions that you're not allowed to travel at all.
So Americans could travel to Germany?
I think so. I hope that's correct, but I think so, yes.
Okay. Dr. K?
I believe so, yes. I think there was an advisement out of the EU, but that has to be adopted by the individual companies that at one point flagged Americans. But those types of advisements are very much in flux at this point. Of course, I think the best way to stop variants is to curtail travel. And if you do travel from an area that's high in Delta or high in another type of a virus to an area that is low, that you should probably get tested and quarantined or self-quarantined before going out in the community.
Okay. All right, Dr. Kavanagh, we have about 3 minutes left, and I toss it back to you.
Well, one of the things I'm really interested in is that in Germany, has this pandemic and public health measures become so politicized where one side's taking the side of doing the measures, the other side's taking the side of not doing the measures because of freedom, and it's really seems to be the central political issue, or is it maintain more of a public health issue in that country?
No, it's also a very divisive issue. So there is a movement that advises to not take the vaccines, to not use the masks, and there's quite a lot of aggression also coming from these sort of communities. But in general, a majority of Germans actually want measures to stay in place. So we've recently had a survey, and the majority of Germans do not want that all measures to limit the Delta variant should be removed.
And how's this impacting lower income? In the United States, we have a real disparity in healthcare, and this pandemic appears to really be impacting a lot of our poorer areas and frontline workers much more severely than, for example, myself that stays at home on his computer. Do you have similar problems over there in Germany?
Yes, absolutely. We've recently seen a very interesting study from Switzerland, our neighboring country, and they determined that in the areas that are the socioeconomically most disadvantaged, that there not only are more people coming down with an infection, but also the risk of severe disease and of death is also higher. But these are at the same time the neighborhoods where people get tested the least. So this again shows you that there is a big disparity that needs to be addressed, especially when you're thinking about the vaccine strategy.
Are home tests available in your country or widely available?
Yes, absolutely. And schools, coming back to schools, in schools they are mandatory. So children are and staff who are not vaccinated need to be tested 3 times a week. And people can also go to a shop or pharmacy and buy tests for home use.
Are they only doing the nose test?
The nose test is most commonly used, yes.
Yeah. Dr. Hoehl, we sure do appreciate you taking time to be with us this morning, and keep up the good work, and thank you so much.
Thank you for having me.
And Dr.
Thank you,
K,
sir.
thank you. We'll talk to you on Monday.